It took several decades to achieve Medicare in Canada, and even then, Medicare was far from universal and fully public. As has been widely stated, the expansion of private clinics and the private delivery of surgeries will mean extra charges for care, aggressive upselling of procedures which patients do not require, and a deeper drain on already insufficient government funding. There is a backlog of 200,000 surgeries, which we are told makes expanding private clinics a necessity. The Premier himself has said that 50% of surgeries could be done out of hospital, meaning they are a target for mass privatization. However, there is plenty of government money and existing public healthcare infrastructure that is being unused. In 2022, 158 emergency rooms in Ontario were closed because of lack of staff, while operating rooms remained idle for the same reason. The province has underspent on healthcare by $1.25 billion during the first 9 months of the 2022-2023 fiscal year, according to the Financial Accountability Office. During the same 3 quarters of this fiscal year, the province spent 104% of the budget attributed to private clinics. This government is starving public health care in order to expand private clinics. The supposed cure, facilitated by Bill 60, is a fatal threat to the public system. The disease our public healthcare system is facing is caused by 50 years of cuts, neoliberal restructuring, other incursions of privatization, and attacks on public sector wages and working conditions. The real cure is to reverse all this and expand public health care to include dental, pharmacare, vision, mental health care, and long-term care. That's the truly universal public health care system we need. So why is this government, and it should be said other provincial governments as well, not all of them conservative, moving in the opposite direction? Corporate interests are keen to capitalize on the crisis in healthcare. If they are allowed to do so, we can see our near future south of the border. Once big business entrenches itself in this area, it will be hard to roll back. It is worth mentioning that corporate Canada has its eyes on the health sector too. One example is Loblaw, which owns Shoppers Drug Mart, of course, and they launched the PC Public Health app in 2020, and in 2021 they purchased a large chain of physiotherapy clinics. Loblaw has said that the health sector is one of its 4 priority areas for growth. This is one of Canada's largest corporate monopolies, infamous for the bread-fixing scandal, and they're in hot water again these days because of price gouging on grocery items, which continues to be a major driver of inflation. This government is not for the people, and it is not working for workers, but instead serves the interests of Loblaws and other monopolies. Fortunately, we know that Ontarians will fight for public health care. The current crisis can be reversed, starting with decent wage increases for nurses and healthcare workers that have had their labour rights stripped from them under Bill 124. Most working-class Ontarians do understand that the idea of profiteering on people's ill health and deaths is reprehensible and inhuman. We urge the members of the Standing Committee to reject Bill 60 in its entirety. Thank you.